hybrid strategy to prevent venous thromboembolism after joint arthroplasty. My name is David Wilches from the Universidad Católica. Definition: the total hip and total knee replacement produces offer the potential to relieve pain and disability, but both surgeries expose patients to substantial risk of thromboembolism. Most experts agree that post-operative pharmacological prophylaxis is guaranteed, but different clinical practice guidelines encompass a relatively wide spectrum of strategies. Recommended approaches range from low-dose aspirin monotherapy at one extreme to the long-term use of an anticoagulant such as low molecular weight heparin at the other. Clinical trials and meta-analyses have suggested that aspirin may be effective for the prevention of venous thromboembolism. After total hip or total knee arthroplasty, but comparisons with direct oral anticoagulants are linking for prophylaxis beyond hospital discharge. There is a video.
Prophylaxis after venous thromboembolism after total hip or total knee arthroplasty has been found to reduce morbidity and mortality. Extended duration of postoperative prophylaxis has shown additional benefit, particularly in patients undergoing total hip arthroplasty. In this multi-center double-blind randomized controlled trial involving 3,424 patients undergoing total hip or total knee arthroplasty, patients received 10 milligrams of rivaroxaban once daily for 5 days postoperatively, and then were randomly assigned to continue rivaroxaban or to switch to 81 milligrams of aspirin daily. Prophylaxis was continued for an additional 9 days after knee arthroplasty and 30 days after hip arthroplasty. During 90-day follow-up, the rate of symptomatic venous thromboembolism was 0.64% among patients in the aspirin group, as compared with 0.70% in the rivaroxaban group. There were 8 major bleeding events among the patients in the aspirin group, and 5 major bleeding events among those in the rivaroxaban group. Similarly, there was no significant difference in clinically important bleeding in patients receiving aspirin as compared with rivaroxaban. The authors conclude that aspirin is not significantly different from the direct oral anticoagulant rivaroxaban for the prevention of symptomatic venous thromboembolism after total hip or total knee arthroplasty after an initial 5-day course of rivaroxaban. Full trial results are available at nejm.org.
Preventing and treating venous thromboembolism, or VTE. When a blood clot forms in the veins of the body, it is called VTE, or venous thromboembolism. Let's break down the meaning of these long words. Venous means vein, thrombus means clot, and an embolism is where the clot moves through the bloodstream to another part of the body. There are 3 types of VTE. 1. A clot in veins just under the skin is called superficial vein thrombosis. 2. A clot deep in the body is called deep vein thrombosis, or DVT. And 3. A clot that moves to the vessels of the lungs is called pulmonary embolism, or PE. DVT and PE are the most dangerous types of VTE. VTE is common, very serious, and can cause death. It is important to take steps to keep VTE from happening and to get the right care if you have VTE. Some risk factors make having a dangerous blood clot more likely to happen. These risk factors include not moving for a long time, such as on a long trip or when staying in bed because you are sick or hurt, staying in the hospital or having surgery, having a baby, taking birth control pills, smoking, having cancer, and/or having some genetic abnormalities. There are a number of ways to reduce the risk of a dangerous blood clot from forming. Sometimes special compression stockings can keep clots from forming in the legs. Some medicines can also help prevent dangerous blood clots. These drugs are called blood thinners or anticoagulants. Blood thinners are given to some patients who need surgery and to people who are likely to experience blood clots. There are two main types of medications used to treat VTE: blood thinners, also called anticoagulants, and clot busters, also called thrombolytic therapy. Blood thinners make it more difficult for the blood to clot. These blood thinners make it less likely for a clot to get started, and they also stop clots from growing larger. Blood thinners include warfarin, heparin, low molecular weight heparin, or LMWH, and fondaparinux. There are also blood thinners called direct oral anticoagulants, or DOACs for short. These include apixaban, dabigatran, edoxaban, and rivaroxaban. Direct oral anticoagulants work very fast and do not need to be regularly monitored by your doctor. They do not affect other medications or food you may have taken. Warfarin does not work as quickly and can cause problems with other medications and limit what you can eat. Warfarin needs to be monitored regularly with blood tests. Heparin and low molecular weight heparin are short-acting medicines that have to be given through an IV or in the form of shots. Heparin needs to be monitored with blood tests. Low molecular weight heparin does not require regular monitoring. Direct oral anticoagulants are the first choice for treatment of VTE in people who may have blood clots but who do not have cancer. The second choice is warfarin. Low molecular weight heparin is preferred in patients with cancer. However, it is the third choice for most patients with VTE since it requires daily injections. Fondaparinux is used on occasion as well. If you need to take blood thinners because you have dangerous blood clots, you will usually take them for at least 3 months. Therapy may need to be longer as well, depending on several different factors. People with blood clots and cancer need to take blood thinners until the cancer is gone. People with previous blood clots may need to be treated for their entire life. You and your doctor should talk about how long you should take the blood thinner based on your risk factors. If you have blood clots in the vessels of the lungs and your doctor feels that something must be done to get rid of the clots faster than your body can get rid of them, medicines called thrombolytic therapy can be given through an IV, or they can be delivered to the clot in the vessels of the lungs with plastic tubes called catheters. These catheters can deliver the medicines to bust up the clot and sometimes even suck the clot out of the blood vessels of the lungs. The decision to use this type of therapy depends on what is available at your hospital and also on your doctor's judgment about what is the best thing to do for you. Usually, these thrombolytic medicines are only used for patients who are at high risk of dying from these dangerous blood clots. Sometimes patients cannot be treated with a blood thinner because of bleeding or because they are at high risk of bleeding while taking one of these blood thinners. When a blood thinner cannot be used in a patient with a VTE blood clot, a wire basket, which is called a filter, can be placed to catch any clots that may break off and go to the lungs. This filter is placed in the large vein called the vena cava that drains the vessels of the legs and body parts within the belly to bring blood back to the heart. Although these filters have some risks over time, they lower the chances of getting a new blood clot in the lung for a short period of time. Because taking a blood thinner is the best way to treat VTE blood clots, a blood thinner should be started as soon as it is safe. Sometimes these vena cava filters can be removed if they are no longer needed. You should discuss with your doctor if your filter can be or should be removed. Treatment for blood clots has several goals. Doctors treat blood clots to keep new clots from forming, stop existing clots from enlarging in size, stop pieces of a clot from moving and limiting blood flow in other parts of the body, avoid complications caused by blood clots, and keep clots from traveling to the lungs, brain, or heart where they can be fatal. VTE blood clots can cause lifelong health problems and may cause death. If you have risk factors for VTE or have had a VTE in the past, be sure to talk to your doctor about ways you can prevent VTE and reduce your risk of life-threatening complications.
And for the conclusion, we can say among patients who receive 5 days of rivaroxaban prophylaxis after the total hip or total knee arthroplasty, extended prophylaxis with aspirin was not significantly different from rivaroxaban in the prevention of symptomatic venous thromboembolism. Thanks.